Hello, everyone. My name is Maddineedi. Thank you so much for joining me today. We will be discussing preventable peril, cervical cancer, silent toll, and women. Every 2 minutes, in the silence of homes and hospitals around the world, a woman's life is taken by cervical cancer, a relentless adversary that strikes with stealth and brutality. Yet amidst this terrible tragedy lies a stark truth. Cervical cancer is preventable. Today, we confront the urgency of this global crisis and ignite hope for change. All right, a little bit about me. Again, my name is Sreenidhi, and I'm a rising junior at Johns Hopkins High School in Union City, California. Talking about some of my personal pursuits, I'm a cancer researcher and mental health advocate, as well as president of a Northern California nonprofit organization, Audacity Academy, and its subdivisions, the Youth Public Health Forum and Audacity STEM Forum. A brief overview of today's discussion, we'll start off talking about the global impact and prevalence of cervical cancer, and then discuss some of the causal and risk factors for its progression, as well as early symptoms, diagnosis, and staging methods. We'll then discuss some of the current treatment options and prevention strategies, and of course, the disparities and barriers to healthcare. We'll then end with a discussion of the global initiatives, case studies, and most importantly, our call to action. So what exactly is cervical cancer? Well, it's a cancer that starts in the cell surrounding the cervix, which is the lower part of the uterus that connects to the vagina. It is primarily caused by persistent infection by high-risk types of HPV, the human papillomavirus. Globally, cervical cancer is actually the fourth most common cancer found in women, with nearly 660,000 new cases diagnosed in 2022 alone. 94% of deaths of cervical cancer are found in low and middle income countries, and in fact, 20% of children who lose their mother do so due to cervical cancer. The emotional toll on families and communities is hence profound and enduring. The American Cancer Society, or ACS, reports that in just 2024 in the US alone, nearly 13,000 new cases of invasive cervical cancer will be diagnosed. The highest rates of cervical cancer incidence are actually found in regions of sub-Saharan Africa, Asia, and Southeast Asia. And in the case of the Central Appalachian region, Kentucky in the US, and also Central American regions. Now, all of these do share one similarity, which is that by facing these high economic distress, persistent poverty, lack of transportation and isolation, they all have suboptimal cervical cancer screening and care. So cervical cancer, again, is caused by HPV infections, which particularly if left untreated are responsive for nearly 95% of all cervical cancer cases and can greatly increase the rate of progression of the disease. There are also different risk factors, such as the rate of the oncogenicity of the HPV type, so the high risk type, immune status of the patient, whether they're immunocompromised, presence of other STIs, and different factors that are listed on this slide. Now, unfortunately, cervical cancer does not have any early symptoms, but once the cancer starts metastasizing in the early stages, we do have some symptoms such as abnormal vaginal bleeding, difficult and painful urination, swelling of the legs, and other symptoms shown here. But remember that these symptoms can be caused by a myriad of other conditions other than cervical cancer. So hence, it is most important to seek the consultance of a healthcare professional. When we refer to cervical cancer and cancers in general, we often refer to it in disease stages, which uses a classification system based on findings from etiology, pathophysiology, and severity to cluster patients. So we use data from visual examinations such as colposcopies for cervical cancer, biopsies such as pap smear, where we're taking cells from the cervix, punch biopsy is a LEAP procedure, and to cervical curettage, even imaging tests and lab tests such as HPV testing and full blood cell counts. Now, the two best ways to prevent cervical cancer are by one, getting the HPV vaccination, and two, testing regularly by the ACS guidelines, by getting the pap test every 3 years and the human papillomavirus, again, HPV test every 5 years. Other measures that can help are by avoiding smoking, which is one of the greatest risk factors for cervical cancer, and by limiting exposure to HPV, such as by using condoms. Remember, early detection and treatment are crucial for improving survival rates, and early treatment is essential for getting better outcomes. When it comes to cervical cancer, there's a whole range even of surgical options, radiation therapies, chemotherapies, immunotherapies, and even new and novel targeted drug therapies, which are still in clinical trials and seem to be very promising. It is important, however, to acknowledge the significant gaps in access to care, which have shifted the burden of disease to mainly resource-poor countries in Africa, Asia, and Latin America. In fact, the annual number of new cases of cervical cancer has risen from nearly 570,000 to roughly 700,000 in the past few years, with the number of deaths by nearly 89,000. Now, there's also racial disparities present in the US, with Black women and Hispanic women being nearly 50% more likely to develop cervical cancer, and in the case of Black women, nearly 60% more likely to die from cervical cancer than their non-Hispanic white female counterparts. There's also different statistics that are shown in this slide. So it is, however, important to acknowledge individual level barriers to care, such as lack of knowledge and education as surrounding cervical cancer screening and just the disease in general, as well as the high cost of these procedures. There's also barriers on this cultural and social level, as regarding community misconceptions and social stigma, as well as on the health system level regarding policy and pragmatic factors, and regarding geographic isolation and transportation. Now, the WHO World Health Organization in 2020 announced their global strategy to accelerate the elimination of cervical cancer, which outlines their three key initiatives regarding one, vaccination, where by 2030, nearly 90% of girls will be fully vaccinated with the HPV vaccination, and two, screening, where 70% of women will have been screened by a high-performance test, and three, treatment, where 90% of women identified with cervical cancer disease will have received treatment, be that pre-cancer or invasive cancer. This means that we can reduce the number of cases by more than 40% and by nearly 5 million deaths by 2050. Here are two case studies in Rwanda and the Republic of Sierra Leone that show some effective cervical cancer prevention strategies that have brought down Rwanda's case of cervical cancer incidence and also have brought them to a 93.3% HPV vaccination rate among young women, but also some of the constraints that may be hindering countries from effectively implementing cervical cancer programs, such as seen in Sierra Leone. Now, remember, but by meeting these 90, 70, 90 targets by 2030, we will be well on the path towards elimination, with 62 million deaths being avoided and 74 million new cases being avoided by 2120. It is thus imperative to take decisive action now to prevent the projected increase in cervical cancer cases and deaths. So we must support these international initiatives and partnerships, which are aimed at achieving the 90, 70, 90 targets globally. At this point, I would like to highlight the case for investment, which by investing to meet those 90, 70, 90 targets, nearly 250,000 women will remain productive members of society and contribute $28 billion to the world economy. So for every dollar invested in cervical cancer, a threefold investment will be returned to the economy. As Dr. Princess Nothemba Simalala says, the fight against cervical cancer is also a fight for women's rights. The unnecessary suffering caused by this preventable disease reflects the injustices that uniquely affect women's health around the world. Together, we can make history to ensure a cervical cancer-free future. At this point, I would like to thank the GHLC team for accepting me to the conference and giving me the opportunity to present my work. And of course, this would never have been possible without the work of the countless researchers, the physicians who are treating individuals, and the global health professionals who are working to raise awareness of cervical cancer. So thank you to all these individuals from the depths of my heart. Here are my references if you're interested in checking them out. And again, my name is Sreenidhi. Thank you so much for joining me today. You can find me on LinkedIn and my email address if you have any questions over here. And again, thank you so much for joining me today to discuss preventable peril, cervical cancer silent toll on women.